Namaste to all of you. The intention of this video clip is to make sure that more and more Ayurvedic doctors are encouraged and inspired to have a Rasa Shastra based, fast acting, reliable, proven track record and most importantly safe combination of herbs, kind of same way minerals and metals combinations that can be used even in an ICU setup or to bring very quick, reliable, safe results. This is the objective of making this video. And we have with us Dr. Aswath Rao, who needs no introduction for the Ayurvedic community, being the doctor who has implemented Rasa Shastra medicines in ICU in COVID. And we already have you will see in that video description the link of the webinar that happened in Sitaram Achar Rasayana on 23rd of January. So I will hand over the further details narration to you.
As I mentioned earlier, the businessman did not take the words of the Vastu consultant seriously. So, and there was no conversation between them, both of them, for a period of almost a year. And after 1 year, the Vastu consultant gets a call from the businessman telling that his daughter had conceived 3 months back, and now they went for antenatal scan. The gynecologist informed that the kid is not having the left lower limb. This was a big shock to them. So these are all indications that we should not neglect our Shastras, even though these might not appeal to us in the present scenario. Definitely there are a lot of things we have to inculcate to our current practice. And there is another example where I got to know an 18-year-old male was intubated and was in an intensive care unit. And the Vastu consultant got a call from the family members that the physicians in the intensive care unit had informed that the kid or the person has a very poor prognosis and very guarded prognosis, that he might not survive for even 48 hours, for the next 48 hours. So he said the problem may not be in his body, because the direction in which you had gone from your home to the hospital is defective. So he told to arrange a ventilator ambulance and shift the patient from ICU, from the present hospital, to another hospital which is in the opposite direction. And to the patient's surprise, the same person who was intubated had come back to the ward just after 72 hours. So I can give you many such examples, my dear friends, where Vastu Shastra or the numerology etc. can play a very big difference in the outcome along with these medicines. Similarly, I know a case of breast cancer, stage 4 breast cancer, who was given palliative treatment. Most of the time we don't give intensive chemo etc. Just to make the patient comfort, they are put on painkillers or like morphine etc. Similar case had approached the same Vastu consultant, and he said the door in the northeast place is kept in a defective direction. So he told to change the direction of the door from north to east, and the patient was none other than a surgeon's wife. A surgeon, I am not telling you about Ayurveda surgeon, he was a surgeon in the field of modern medicine. Even it was difficult for him to believe in the initial stage, but he had nothing to lose, so he had the faith and he changed the door. And she had extensive metastasis, pulmonary metastasis. And to their surprise, just on palliative treatment, after 3 months, the metastasis had regressed. And he did some minor surgeries, and now even till date, she is doing absolutely fine. And at present, he is the same Vastu consultant. He is building a big hospital for this surgeon, assisting in this surgeon building a big hospital, which will soon be started in a few months. And not only that, I feel, my dear friends, even the date when we start the treatment is also very important. For example, numbers like 4 and 8, 13th or 17th, which equals to 3 plus 1 4, 7 plus 1 8, or 22nd 2 plus 2 4, or maybe 26, 2 plus 6, 8. So all these dates we should avoid beginning the treatment to any new patient. The reason being, this is what I got to know from Vastu consulting experts, that either the treatment will not succeed or the patient might recover, but the doctor will be kept in a bad position. He might be humiliated or he may not be given the credit. So along with these medicines, I feel the outcome also depends on the date we start the treatment. Also, when I sit and consult the patient, for example, they say the doctor should be facing towards north and the patient obviously towards the south, the way to consult the patient. Or when I am doing the surgery, there is a direction in which the patient should be placed. All these things matter in a big way towards the outcome of the result. I think we can improve the outcome of our treatment along with these medicines, even following our shastras to the fullest possible extent. Thank you, my dear friends.